Good morning everyone. Today my presentation topic is fixed orthodontic appliances. So first let's start with the components of the fixed appliances. Basically there are two types of components in the fixed orthodontic appliance. Active component and passive component. When we look at the active components, there are separators, arch wire, elastics and spring. In case of passive component, there is a brackets, band, accessories, and molar tube. In separator, there are two types, elastic and metal one. In the different accessories, there is a lock pin, ligature wire, modules. So these are components of the fixed orthodontic appliances. This is all we have already discussed. So let's look in the picture. We can see posteriorly there is band. They are like usually used, we use that band on the posterior teeth. These are the hoods which we solder on the arch wire. This is the arch wire. These are the elastic modules which we use to ligate the arch wire in the bracket slot. These are the orthodontic bracket, which is another passive component. And then this is the rubbers or elastics. This is last two elastic. We start from the hood, from the maxilla to the molar tube hood. So these are the rubbers, which is another active component. So in this figure, we can see which are the components we normally use the orthodontics. So first starts with the different steps before starting the fixed orthodontic treatment. So first one is the steps in the bending. For bending, we have to do bending as circumference to the uh, molars. So first we need to separate them to add the bend. So we are adding separator in the mesial and distal embrasures. So these are the separators which we generally prefer for the time for 24 to 48 hours, which we need to separate the tooth from the adjacent tooth. And whatever space happen with the separation of this using this separator, we usually fit the bend in that. For this bending, we need require bend material, tube, different types of plier, welding machine, and cement which we use for cementation. So these are the different types of bend and size. This is a bend material. These are different types of pliers. These are the hole pliers, right and left, a bend pinching plier. So these are the pliers which normally we use to fabricate the bend for individual tooth. So in this figure, you can see first we cut the bend material, whatever is required for individual tooth. Then intraorally in figure B, we can see by using with the hole plier, we can adapt the bend material and we mark that lingually with using this plier. Then this is a welding machine. In welding machine, we weld this. Then we cut the extra bend material. Then again we weld this over that and we can check the adaptability of the bend material and the bend over the tooth. And then we weld the weldable tubes over the bend material. So this is a spot welder which we commonly use while doing bending. You can see the different parts of the spot material. Let's start with the one. This is a power button which we use to on and off the welder. Second one, this is a to decrease or increase the power value. The third one, which is a display screen over which we can see the timing and the value of the power. Then four one, you can see the electrodes. This is upper one, this is lower one. And in between this, that is a generation of the heat between the electrodes. This is a five, this is a stable button and we can use the start button. So this is a welder, this is a spot welder we normally use in dentistry and orthodontics to weld the different type of the metals. Now come with the arch wire. This is also another passive component. There are so many different arch wires we can use in orthodontics. So one of them is the stainless steel arch wire. These are commonly used in retraction mechanism which gives stability to the arch. So, and it gives the less friction. But what are the disadvantage of using this wire? They have not much low springy bed. Even frequent activation is required due to lower springiness. they deliver higher force, and sometimes there is problem in the soldering with that another metals. So if we look at in this table, you can see there are different types of arch wire. First one is stainless steel, which we already discussed. Second one is blue alloy wire. There are normally in alloy wire, there are four different type 1, type 2, type 3 and type 4 arch wire. They have different temperature of welding. So according to that, we have given the four types, which is used in certain type of condition by for preparing loops or preparing spring, because it has the advantage of maximum resiliency. Third one is the TMA wire, that is a pita titanium wire. It is also used for preparing the different types of spring because high resiliency. But the problem with this wire is it has the high friction. So it is normally preferred while giving the frictionless mechanics. Now last one is the nickel titanium wire, in which 55% nickel and 45% titanium. This wire we use in the initial phase when there is a crowding in the patients, when there is rotation, so we can fully engage because they have the highest springy bed. Now we can classify the arch wire according to cross section also. If you see the first figure, there is a rounded wire. The second figure, there is a rounded rectangular. Third figure, it's a rectangular arch wire. These are the basic three shapes which we commonly use. Now, if you see there is a coaxial. Coaxial means there is one main arch wire in middle one, and the surrounding there are different wires. They are twisted and there is a coaxial arch wire. Second one is the twisted one and third one is the woven one. They are, have the highest flexibility. This wire, both flexibility and strength. So this we commonly prefer when we require the finishing stage. Now comes to the bracket. This is also the another passive component of the fixed orthodontic treatment. If we start with the historical perspective, usually Engel has developed the first appliance, that is Engel's E-arch appliance in 1907. After that, there is a Kelvin case appliance, then pin and tube appliance, Robinson appliance, Engel's rubber charge appliance. In between that, there are the one brackets which are the beds appliance. And after that, Engels has developed edgewise appliance in 1925, which we commonly use when we get the straight wire appliance in 1976. Till that, we can use this type of the brackets in orthodontics in the fixed treatment. Now, if we see the classification of the bracket with the constitution, so there are metallic brackets, either bondable and weldable, and non-metallic, they are the plastic and ceramic. According to the placement, labial bracket and lingual bracket both are available. According to the anatomical basis, there is a flat and curved bracket, they are available. So these are the classification of the bracket. If you look at the picture of the bracket, you can see there are two wings as they are twin bracket, one slot, then there is a mesh in the base which we use to bond this bracket over the tooth surface. Even these are the, see, the rhomboidal shape bracket. In one there is a curvature surface which goes gingivally. These are the lower incisor bracket with two wings, one slot and markings here, which marking which we are bonding incisally or gingivally. Now let's discuss the first appliance, that is E-arch appliance. It is the first orthodontic fixed appliance which is rigid one. Engel has developed this appliance in which there is a main arch which is wire is soldered into the molar band, and there are different wires which are running from individual tooth and they have tied that with the main arch wire, and this is the way they are giving force. So it's a E-arch appliance. After that E-arch appliance in 1912, Engel has modified this appliance to another one, that is a pin and tube appliance. In pin and tube appliance, every teeth there is a welding of there is a preparation of the band. Then one pin-like structure which is attached over that. Then arch wire is made with the gold or stainless steel, and we have to solder that arch wire with this band. It's a very difficult one appliance. Only the Engel was the person who was used to with this. So after they have corrected, there is a development of the ribbon arch appliance in 1915. To overcome the disadvantage of pin and tube bracket, they have introduced the slot. It is a vertical one. So vertical slot was introduced and the different types of pin were available. They have there is a brass wire pins and we can add the wire with using the pins in this appliance. But by this, we can overcome the main two problems, the arch wire placement and also there is the mesiodistal movement of the teeth along with the arch wire because there is a free movement in the slot. So it's a ribbon arch appliance in 1925. You can see the bracket. These are the dimension of the bracket. This is vertical slot. Here we ended the slot here and we fix the arch wire with the pin, brass wire pin from this. So these are the authors and the pioneers in the orthodontics, the Edward Engel. Now comes with the bonding procedure. How we bond the brackets on the tooth surface, in which first one is the cleaning, then enamel conditioning, third one is the sealing, and fourth one is the bonding. You can see this figure. First we need to do scaling of the teeth particularly. So we need to clean the teeth. After cleaning the teeth, we need to do polishing to remove the enamel pellicle over the labial tooth surface. After that, we need to etch the required tooth surface over the labial surface on which we bond the bracket. After etching and cleaning with the water, we should take care, we should not use any oily substances while cleaning. After that, we have to condition the tooth surface. So we have to apply the bonding material or primer over the tooth surface. Then we have to place the bracket into the proper position by using gauge and the pliers. Then we have to fix them, we have to cure them, and this is the way we bond the bracket sequentially. This is another one which showing the curing of the bracket. Now comes to the elastics. See, elastics is the active component of the fixed orthodontic treatment. There are different types and different colors of the elastic we normally prefer. There are class 2 and class 3 elastic we normally used in fixed orthodontic treatment, even finishing elastics also used. If you see this figure, this is a class 2 elastic. We start with the hook of the canine bracket to the molar buccal tube. This is again class 3 elastic. We start with the hook of the molar and again which ended. This is a elastic for giving the force with the elastic. Patient cooperation is very much required as the patient has to wear the elastic by themselves, whether it is class 2 or class 3. And it gives vertical force and also the force into the transverse direction. If we want to use the fixed appliances into the along with the orthopedic appliance, those elastic are different and they use more force when we use with the headgear or face mask. So in those type of patient, there is a orthopedic force is used and we use the orthopedic force to correct those. So those elastic have different forces. So normally green, blue, red, these are the different elastics. They have different uses of the forces. This is a very important component in the fixed orthodontic treatment to correct the sagittal and transverse discrepancy. Even elastics are also used to correct the cross bite and the scissor bite, individual tooth scissor bite. So we can apply the cross elastic also. So elastic is also used in case of finishing. When we require, there is perfect intersuspension of the posterior teeth, even midline correction. In those type of patient, we use the elastics in the fixed orthodontic treatment. Now comes with the elastomeric chain. See, there is a short, continuous and long. If we use short elastomeric chain, it will give high force. If we give continuous elastic force, it is more high. And if we use long, it is comparatively lesser. This elastic chain is used over the arch wire to close the generalized space into the arches. But it is also have some disadvantage because there is lots of food lodgement in between the teeth. Then there is a periodontal inflammation we can see with using the elastics. So we have to be careful while using this elastomeric chain, and we have to select the proper elastomeric chain while doing the fixed orthodontic treatment. Now comes to the bottle tube. This is also the passive component in which there is a mandibular. All the four molars have the different buccal tubes. Even for the second molar, we have different buccal tubes. In buccal tubes, there is a rectangular slot, and in some times there is maxilla. There is another tube is also slot is also available. This is either to give the headgear. This is the headgear tube. So this we can use either to give headgear or to engage the arches of the headgear to the arch wire. And second, this is also used when we want to give the forces appliance or any fixed functional appliance. These two slot buccal tubes are used. These are the bondable buccal tubes because they have mesh which we can bond. There are weldable buccal tubes which we need to weld with the using the spot welder with the tube to the bend material. This is the another passive component. These are the bondable buccal tube. You can see the mesh of this tube which is basically used for bonding. This mark which suggests whether this is right and left because this hood which is used basically for to engage the elastic and is usually directed into the distal direction. So according to this marking and the direction of this hood, we can identify this buccal tube is of which arch and which tooth. So these are the tubes, they are the passive component. Now comes with the separator. See, these are the elastic separators and these are the metallic separator. The elastic separator, we need to use the separator placement plier and we need to add, this is a little bit technique sensitive and the even forceful procedure. We have to engage the separator into the plier, we have to expand the plier and we have to engage in the mesial and distal embrasure we used in that plier. Now, these are the metallic separator. This is a Kesling tooth separator, which is very useful to separate the tooth from each other. So this is the helix and we give the force with using this. These are the active components which we normally prefer when we want to separate the tooth from the adjacent tooth. This is the ligation. This is also another passive component. See, in ligation, normally we use the modules, which engage the wire with the packet slot, and over that we can attach this module. But the problem with this module is there is a change in the color. That is the first problem, and the second problem it might break. And the third problem is it don't give perfect engagement of the wire into the slot. So for that we are giving this ligature tie. So it is a metallic wire which is 0.09 to 0.10 millimeter which we use to ligate the arch wire with the bracket. This is a very nice ligation which have less friction and which give the perfectly ligation of the arch wire into the slot. Now, there are the self-ligated system also available in the market in which there is no need to use this elastomeric nodule and this ligation. So we can engage the arch wire by using the tips. There are active and passive self-ligated appliances which are available in the market. So which we can prefer. It has advantage and disadvantage both. So we have discussed already all the parts of the fixed orthodontic appliances, which comes basically to active and passive. In active, there are elastates, there are arch wires, there is elastomeric modules. There are so many active components. And the passive components, brackets, then the bonding, the bands, these all the things we have already discussed. So this is all about fixed orthodontic. Thank you.